Good afternoon. Welcome to reading live session. This is 𝐕 PS joining you from 𝐻𝐿 Academy. Yes, a new Thursday, a new material, a new day. So yes, a new opportunity. So please tell me, how's your day going? How are you all? Doing good? So we are here with yet another new material, that is orthognathic surgery. All right. So I'm waiting here for the comments. Good afternoon, everyone. All right. So before moving to the material, let's condense something related to part A. Okay. So do you have an idea regarding what is part A, or what about the strategy that we are doing or applying in part A? Any idea? What is part A? Okay, so only after the completion of part A material, they will provide you with part B and part C material. Okay, so the total time for the exam is 1 hour. And in that 1 hour, we are spending almost 15 minutes for doing part A. Okay, so that is all about the timing. And what about the strategy? Any idea? What about the strategy? Yes. Good afternoon, Tensi, Jyoti, Kavita, Sharmila, Sabida, Prasad. Okay, good afternoon, everyone. Tell me, what is the strategy that we are applying in part A? Yes, very good. It is skimming and scanning method. So what is skimming and what is scanning? It is very easy for you, I know that, because majority of the students are attending the daily live sessions. So definitely, what is skimming and scanning? Yes, tell me, what is skimming and what is scanning? Any idea? Okay, skimming, which means fast reading or quick reading, whereas scanning, which means we are searching for some particular words or important words from the paragraph or the text. So we have 4 texts here in part A. So to complete this 4 texts, it will take almost 15 minutes. Okay. Okay. So yes, that is skimming and scanning. Yes, quick look. Very good, Sabida. Skimming and scanning. Yes, skimming and scanning. Scanning means detailed look. Very good. Okay. So we are searching for some particular or important words from the texts. All right. So here we have a new material, as I already mentioned, that is orthognathic surgery. Okay, so let's look into the material now. All right. Okay, so before moving to the material, let me introduce you the type of questions, okay, or the question patterns. And as you can see here, we have total 20 questions, and this 20 questions we have to complete within this 15 minutes of time. So 1 to 7 questions will be based on match the following questions. Clear? And what about this rest of the questions 8 to 14, which is all about short answer questions, and the rest of the questions will be based on fill in the blanks type of questions. Okay. So when you match the following questions, when you answer this match the following questions, it is very important to know what they have mentioned or what they have described in each of the texts. Okay. So now let's look into these 4 texts. So text A, and as you already said that we are applying the strategy called skimming and scanning method. So what are the important words? We already said that we are searching for some important words from the text. So what are the important words? Any idea? What are the important words? What are the important words? When you skim and scan, what are the important words that we are searching for? Yes, Monica, have you any idea regarding what are the important words that we are searching for? Yes. Okay. So when you search for the important words, you can mark all the headings, all the subheadings, all the numbers, all the signs and symbols. For example, they will mention the percentage sign. Okay, maybe greater than or equal to. Okay, they will mention a lot of signs and symbols. So when you mark the keywords, it is important to mark all the headings, all the subheadings, all the numbers, all the signs and symbols, then all the names. So what do you mean by all the names? Okay, that is called proper nouns. So when I say name of a person, okay, name of a disease condition, name of a country, so whatever they have mentioned here with a name, you can mark it. Clear? Okay. Yes, some nouns, numbers, headings, subheadings. Yes. Okay, very good, very good. All right, so what is next? What is the next important thing that we can mark? Okay, after this, we can go for some abbreviations. So what are abbreviations? The short forms. Okay, so whatever short forms they have mentioned here in each of the test, we can mark all the abbreviations. Okay, and what is next? Symbols, proper nouns, okay, abbreviations. What is next? Okay, and you can mark some words which indicate timing. So can you tell me what are the names or what are the words that indicate timing? For example, the word when, W-H-E-N, when. Okay, now, then currently, presently, okay, early, delay. So these type of words that indicates timing. Okay, years, abbreviation, small words, symptoms, yes. All right. Okay, so the words which indicate timing we can mark, as well as those words which are related to experiments. The word itself, experiment, is an important word, as well as the term research, researcher. All right, clinical or clinical observations, identification, diagnosis. So these kind of words are really important. Hope it is clear, right? Okay, and when you read each of the text, it is very important to focus or emphasize some important sentences. Okay, so I can say when you read the text, it is very important to focus on the first line of each and every paragraph, as well as the last line of each and every paragraphs. Clear? Okay. Then, as well as you can focus on all the bullet points. Okay. So whatever the bullet points they have mentioned in the 4 of the text, it is very important to read very carefully. Okay. As well as those words or sentences which is mentioned in the brackets. Okay. That is also very important. Clear? Okay. So this is all about skimming and scanning method strategy. So we are reading the 4 text very quickly, as well as we are marking the important words or sentences from each of the texts. All right. Okay, clear everyone? Yes. Words from the brackets, yes. Previously, lately, symptoms, yes, yes, yes. Very good, very good. Okay, nice participation, thank you. Okay, so we are moving with the first text A. Okay, so you guys can read with me, and we are going to underline the keywords or main important words from the text. So text A, there is no heading, no subheading. Orthognathic surgery is the name of a surgery mentioned here, is a surgical procedure to treat problems related to jaws. The jaw can be broadly classified into the upper jaw, that is maxilla, and lower jaw, which is mandible. Then the upper jaw is responsible for shaping middle face, while the lower jaw moves open or close the mouth, or speaking or eating. Then the lower jaw also provides shape to the chin and lower face. However, there may be irregularities of the bones in some cases, which can affect essential functions like sleeping, talking, chewing, or following a daily routine. Okay, so what about the second paragraph? The same surgery, the name is mentioned there, so you don't have to mark the similar words or the same repeated words. Then the orthognathic surgery is performed to correct the abnormal jaw relationships. The surgery is also known as corrective jaw surgery, that is an alternative name for the surgery, and is performed by an oral and maxillofacial surgeon. Alright. In addition, orthognathic surgery can sometimes correct aesthetic issues like congenital disability, unbalanced facial appearance or more. Okay, so these are the keywords which I have marked from text A. Clear? Okay, so we are moving to the next one, that is second text, which is text B, and we have a title as well as some subtitles mentioned. So the first one, common orthognathic surgeries. What are the common surgeries mentioned? So the first one is Layford osteotomy. That is the first one. Then this procedure involves separating the upper jaw maxilla from other facial bones. The upper teeth can then moved forward, rotated or moved up and down to lengthen or shorten your facial appearance. The upper jaw is placed precisely where the surgeon and orthodontist plant and is then fixed in a place with titanium plates and screws. These do not set off metal detectors and do not need to be removed. So this is all about the first surgery. Okay, then moving to the second one, that is bilateral sagittal split osteotomy. This procedure makes precise cuts in the lower jaw on the both sides. The lower teeth and chin can then be moved forward, backward or rotated. The teeth are also precisely placed in their planned location and the mandible is fixed in its new location within titanium plates or screws. And the next one, that is bimaxillary osteotomy. This procedure combines, so the previous two, Layford 1 and bilateral sagittal splits, to correct more complex deformities that affect both upper and lower jaw. Patients with significant facial asymmetry, abnormalities in both jaws, larger distances between their upper and lower teeth or syndromic conditions may require this operation or the surgery. Both operations can be safely combined without increasing your recovery time. Then we are moving to the next text. So that is text C, causes of nerve injury, orthognathic surgery. So they have mentioned a lot of factors here regarding the causes of the surgery. Okay, so just read carefully what are they. Okay, then moving to the last text, that is text D, there is a follow-up. Okay, so what we have to do, what are the instructions, what are the recommendations that we can follow? So this is mentioned here in text D. So what are the recommendations? Follow wound care instructions mentioned here, as well as in the first paragraph they have mentioned the time period, the duration for the heal properly. Okay, so it will take 6 to 8 weeks to heal properly. After the surgery, one may feel swelling, okay, and discomfort for the first few days. The swelling generally goes away after 3 weeks. Okay, then they have mentioned what are the instructions that they have to follow. Okay, so these are the instructions. This is all about the 4 texts. And we are moving to the first question. So what is the first question mentioned? Recommendations for the patients to overcome hurdles following the surgery. So that is the first question mentioned here. Recommendations. So we have just read the recommendations or the instructions from text D. So it is very easy. Recommendations or instructions for the patients to overcome hurdles, the complications following the surgery. So these are the keywords from the question. So any idea? Yes, Sabida, it is text D. Very good. Monica, yes, text D. So that answer is text D. Already we have read that text just now. That is all about the instructions, okay, or we can say the recommendations to minimize the risk of complications. So that answer is text D. All right, so what about the second question? A surgical procedure that is advised to correct significant anomalies that affect both jaws. So where is it mentioned? Any idea? A surgical procedure that is advised to correct significant important anomalies that affect both jaws, the upper and the lower jaw? Any idea? Okay, Monica, very good. It is text B. Okay, so where is it mentioned in text B? So the third surgery, that is bimaxillary osteotomy, they have mentioned this particular procedure, or this procedure combines a Lefort 1 and bilateral sagittal split osteotomy to correct more complex deformities, anomalies which we can connect with deformities that affect both the upper and lower jaw. See, that is the both. Okay, so the answer is text B. Okay. Then the next question, role of submaxilla. Okay, so nothing mentioned about submaxilla, the word, I am talking about the word submaxilla, but they have mentioned somewhere in the text maxilla. Okay, so where is it mentioned, the role of maxilla? So what is maxilla and what is submaxilla? Any idea? Anyone? What is maxilla and what is submaxilla? Role of submaxilla. So here in the first text, okay, they have mentioned maxilla in the second line. Orthognathic surgery is a surgical procedure to treat problems related to jaws. The jaw can be broadly classified into the upper jaw, that upper jaw which can be called the maxilla. So what is submaxilla? Which means the lower or mandible. Okay, lower jaw or mandible, that can be called submaxilla. Okay, so see then, the lower jaw, the third line, the lower jaw or the submaxilla also provides shapes to the chin and lower face. However, there may be irregularities of bones in some cases which can affect essential functions like sleeping, talking, chewing or following a daily routine. So that answer is text A. Hi Tijo, how are you? Good afternoon. Yes. Okay, happy to see you here. Yes dear, so the next question, fourth one, functional and aesthetic goal of bimaxillary osteotomy. Okay, so where is it mentioned, the bimaxillary osteotomy? It is very easy to find the answer here because that particular surgery which is mentioned in which text? It is in text B. Okay, functional and aesthetic goal of bimaxillary osteotomy. So as you can see here from the third surgery, they have mentioned about the function. Patients with significant facial asymmetry abnormalities in the jaws, larger distances between their upper and lower teeth or syndromic conditions may require this operation. Both operations can be safely combined with increasing your recovery time. So the second, third line which indicates all about the functions and aesthetic. Okay, so the question is all about functional and aesthetic goal of bimaxillary osteotomy. Okay, yes, okay, fifth one. What is the fifth question? Fifth question, prolonged time for the swelling to disappear once surgery is done. Okay, so once the surgery has done, there is a chance for what? Swelling. Okay, and which is mentioned here as you can see in the last text, text D. Yes, Claudine, yes, good afternoon. Reshma, good afternoon, yes. Okay, so we are in this fifth question and the answer is from text D. See the first paragraph, patients go through orthognathic surgery can take about 6 to 8 weeks to heal properly. After the surgery, so once the surgery has done, okay, one may feel swelling and discomfort for the first few days. So that answer is, it is from D, text D. Then the sixth question, objectives of corrective jaw surgery. Okay, so what is corrective jaw surgery? Okay, when we read the first text, okay, already we have underlined or we have noticed something from the second paragraph. There is an alternative name for orthognathic surgery. So what is that? That is corrective jaw surgery. Okay, so which is mentioned in text A. So, that answer is text A. Alright. Then 7th question. Factors responsible for the occurrence of nerve injury in orthognathic surgery. So, where is this nerve injury mentioned? Okay. So, which is mentioned as you can see here in text C, causes of nerve injury in orthognathic surgery. Okay. So, that answer is from text C. Clear? Any doubts regarding 1 to 7? Match the following questions. Any doubts? Anyone? Asha? Yes. Maria, are you there? Arul, Monica, Kavita, Abhi, yes. Any doubts? Nothing. Okay. So, we are moving to the second set of questions which are called short answer questions. Okay. So, it is very important to read the instruction which is given here. Answer each of the following 8 to 14 questions in a word or short phrase. So, what do you mean by a short phrase? Okay. Combination of words can be called short phrases. Okay. So, in this particular language exam, they are mentioning about short phrase here, which means you can write maximum of 3 words in a short phrase. Very good, Monica, you got 7 out of 7 for part A. Congrats. Okay. Yes. So, what about short phrase, which means 3, maximum of 3 words you can write. Each answer may include words, numbers or both. No problem. Okay. 8th question. What is the source of direct trauma which can then cause nerve injury in the orthognathic surgery? So, the nerve injury, trauma, where is it mentioned? As you know, which is mentioned in text C. Okay. So, what is the answer? See this second last point, directive trauma, that is the keyword from the question. Nerve injury, again keyword from the question. So, what is the answer? So, the trauma, direct trauma with surgical instruments. So, that answer is surgical instruments. Clear? That is the source. What is the source? Surgical instruments. Clear? Then 9th one, the part provides configuration to the chin and lower face. Okay. So, the part provides configuration. So, where is it mentioned? Any idea? The chin and lower face. Okay. What is the correct answer? Any idea? Can you please comment for the 9th question? Okay. So, that lower, yes, the chin, and it is mentioned in text A. Okay. So, as we can see here, as you can see, the lower jaw also provides shape to the chin and lower face. So, what is the answer? Okay. The lower jaw also provides shape to the chin and lower face. These are the keywords from the question. What are the keywords? Chin and lower face. So, that answer is lower jaw, or you can write mandible, because they have very clearly mentioned in the brackets. Clear? So, that is the answer. Okay. 10th one, impacts, after effects of unfavorable fractures in corrective jaw surgery. So, again this corrective jaw surgery, what is the impact of unfavorable fractures? Okay. So, what are the impacts? As you can see here, it is because of the causes of nerve injury. So, what are the causes mentioned? Unfavorable fractures, aggressive retraction, hemorrhage, hematoma formation, post-operative edema or indirect trauma, direct trauma, stretching during manipulation of osteotomized segments. Okay. So, that answer is, what is the answer? It is nerve injury. So, that answer is nerve injury. Clear? Okay. So, the next question, 11th one, an alternative denomination for orthognathic surgery. Alternative denomination, denomination which means what? What is denomination? What is denomination? which means name, alternative name or alternative designation. Okay. So, that is what is the alternative name for orthognathic surgery. It is very simple, and that is from the first text. Okay. Second paragraph they have mentioned regarding the alternative name for orthognathic surgery. See the second sentence. Okay. So, the surgery also known as corrective jaw surgery. So, the answer is corrective jaw surgery. That is the alternative name for this particular orthognathic surgery. So, that is the answer. Okay. So, the very next question, name the surgery which segregates, which means separates the maxilla from other facial bones. Okay. So, where is it mentioned, the surgeries, different types of surgeries or names of surgery? As you can see from, it is mentioned in text B. Okay. Common orthognathic surgeries. So, what are the surgeries? Layford first osteotomy, then bilateral sagittal split osteotomy, then bimaxillary osteotomy. So, what is the correct answer for this question? It is from the first surgery, okay, that is Layford first osteotomy. Very good, Sabita. Yes, Monica. Sanida, you got the correct answer. Very good. Okay, Layford first osteotomy. This procedure involves separating, segregating, that is the keyword from the question, the upper jaw, that is the maxilla from the question. So, from the other facial bones. So, the answer is Layford first osteotomy. Yes. Okay, very good. Then the next question is 13th one, maximum time taken by the surgical site to heal properly. So, the instructions for the healing which is mentioned in text D. Okay. So, what are the instructions mentioned? So, these are the instructions mentioned, and the healing which is mentioned in the first paragraph from text D. Okay. Yes, the first line. Patients that go through orthognathic surgery can take out about 6 to 8 weeks to heal properly. So, what is the maximum? That is the question, right? Okay. So, what is the maximum time? So, 6 to 8. So, minimum which is 6, maximum that is 8. So, that answer is 8 weeks. Okay. Answer is 8 weeks. Alright. The last question. No, not 6 to 8 weeks, Asha. In the question they are asking about maximum. Okay, the maximum period of time taken for healing. So, that is not 6 to 8, just 8. Okay, you can write 8 weeks, that is enough. Clear? Okay. Then the 14th one, devices used to fix the mandible in the new location during bilateral sagittal split osteotomy. So, that particular name of the surgery which is mentioned in text B. Okay. So, that is bilateral sagittal split osteotomy. So, any idea what is the correct answer here? See the last line. The teeth are also precisely placed in their planned location, and the mandible, these are the keywords from the question, is fixed in its new location, another keyword from the question, with titanium plates or screws. So, that answer is titanium plates or screws. Okay. That is the answer. Okay. Then what about the next set of questions that can be called fill in the blanks questions, and once again we are reading the instructions which is mentioned here. Complete each of the sentences 15 to 20 with a word or a short phrase again, okay, which means you can write maximum of 3 words from each one of the texts. Each answer may include words, numbers or both. Okay. Then 15th question. Stretching during manipulation of dash may result in nerve damage in orthognathic surgery. Okay. So, what is the missing word there? As we can see from text C, okay, the last point, look at the last point. all the other keywords mentioned there in the last point. Stretching during manipulation. So, these are the keywords from the question. So, what is missing there? That is osteotomized segments. Okay, so that is the missing word. Then the 16th question. The patients are advised to consume dash foods post to surgery. So, what is the correct answer? Post surgery, complications of post surgery, which is instructions that we can follow after the surgery. So, that is from text D. Okay. So, follow wound care instructions. So, what is the first point mentioned there? Eat easy to chew foods. So, that word itself is the keyword from the question. Very good. So, when you write easy to chew, okay, you should write that what? Hyphen there. You should mention the hyphen there. Otherwise, it is a wrong answer. Okay, because easy to chew in the paragraph, it is a hyphenated word. So, don't forget to mention the hyphen. It is a hyphenated word, right? Okay. Okay. Yes, you have to mention the hyphen. Yes. And when you write that particular word, easy to choose, don't write it in a capital letter. E should be small letter, not caps. Okay, not in a capital letter. It should be small letter. Easy hyphen to hyphen chew. That will be the answer. Okay. Then 17th question. Furthermore, orthognathic surgery can sometimes correct dash like a congenital disability, unbalanced facial appearance or more. So, tell me what is the missing word there? 17th question. Any idea? What is the missing word from question number 17? Okay, see the second paragraph. It is all about the surgery. Orthognathic surgery is performed to correct such abnormal jaw relationships. The surgery is also known as corrective jaw surgery and is performed by oral and maxillofacial surgeon in addition. So, that is the keyword from the question. Furthermore, orthognathic surgery can sometimes correct aesthetic issues. So, that is the missing word from the question. Okay. So, that is aesthetic issues. So, answer is aesthetic issues. Yes. Okay. So, the next one, 18th one. They may feel dash and discomfort for the first few days and it generally goes away after 3 weeks. So, what are the problems they will face after the surgery and which is directly mentioned in text D. Okay, see the second line, second sentence. After the surgery, one may feel swelling. That is the missing word from the question. And discomfort for the first few days. So, these are the other keywords from the question. Discomfort, first few days. So, the missing word is swelling. Okay. So, that is the correct answer, swelling. Okay. Then the second last question. Orthognathic surgery is a surgical procedure to treat problems related to dash. What is that missing word? Orthognathic surgery is a surgical procedure to treat problems related to dash. Any idea? Very good, Reshma. Answer is jaws. Okay, JAWS. Okay, and that J should be in small letter. Okay, don't write that J in caps. It is J in small. Okay, so which is mentioned in the first line of the first text. That is the first line. Okay, related to jaws. Moving to the last question, that is question number 20. Patients with major dash abnormalities in both jaws, larger distances between their upper and lower teeth may need bimaxillary osteotomy. So, what is that? What is the last question? What is the answer to the last question? Where is it mentioned? Okay, which is mentioned here in text B. Very good, Sabida. Your answer is correct. That is facial asymmetry. okay, as it is from bimaxillary osteotomy, one of the surgery mentioned in text B, the third surgery. See the second line, patients with significant facial asymmetry, abnormalities in the both jaws, larger distances between their upper and lower teeth, or syndromic conditions may require this operation. Which operation? Bimaxillary osteotomy. So, what is the answer? It is facial asymmetry. Facial asymmetry is the answer. So, that is that. Any doubts? Very good, Monica, you got 20 out of 20. I am so happy. Okay, Zabida? Yes. Anyone else with 20 out of 20? Please comment. Okay. So, as I was always saying, if you have any concerns regarding the classes, regarding the materials, regarding the sessions, regarding the trainers, anything, you can contact us to the number which is mentioned here on the screen. Okay. So, yes, okay, okay, Sanida, yes, Kavita, okay. Okay, you completed in 9 minutes, very good, okay, appreciate you for that. Okay, so take care, God bless you all, thank you.